Marianne, for those kind remarks. You know, we all have a story to tell. Mine will not mirror yours, nor does it define me. But I do appreciate this occasion to be able to invite you to listen to it. And perhaps you'll be armed leaving this service with a little more understanding of what Parkinson's disease is all about. When my neurologist suggested I might have Parkinson's back in 2012, I have to admit I knew very little about this disease, something that was going to impact myself and those around me in a very profound way. You see, persons living with Parkinson's have difficulty performing even the very simplest everyday tasks that most people do automatically. Rolling over in bed, getting up, getting dressed, eating, retrieving medications, just to name a few. So let me tell you a little bit about Parkinson's. There are 4 hallmark signs of Parkinson's disease: rigidity, tremor, postural instability, and either akinesia or bradykinesia. Parkinsonians may have some of these or all of these symptoms, and they may add to them as the disease progresses. My neurologist noted that I had a unilateral tremor on my left side and some akinesia, meaning that my left arm didn't swing when I walked. Since then, bradykinesia and rigidity have made an appearance. But how did I get to an office of a neurologist in the first place? And what led her to make that diagnosis? The seemingly jumping leg, left leg, in 2010 seemed innocuous enough. Even my family doctor considered it might be just restless leg syndrome. But he moved very quickly on referring me to a neurologist once I told him that it was on the move, up my torso and down my arm. To my knowledge, at this point, I really only had a tremor. So I wasn't particularly alarmed or worried, just a little concerned. After taking a medical history and offering some self-reported symptoms and having a clinical examination, the words Parkinson's disease were uttered. You see, there's no definitive way to determine if you have Parkinson's while you're alive, nothing like a blood test. However, in my case, they did do a CAT scan to see if they could rule out through any pathological or physiological rather, reasons for the tremor in my leg, such as a brain tumor. Well, the results were negative, so now the diagnosis was confirmed. And apparently I did have some symptoms that only a trained eye could detect. When the offer came in for a second opinion, I eagerly grabbed it. And I met then with a very well-respected neurologist and researcher in London who specialized in movement disorders. So what exactly is this disease? Well, the short answer, it's a complex, progressive, neurological disease for which there is no cure to date. The crux of the problem is the loss of dopamine, which is a neurotransmitter used by the brain to relay signals. With the loss of this chemical, the brain can neither generate nor transmit proper messages to control movement. By the time one is given a diagnosis, it is thought that over half of the cells in the substantia nigra have been already impaired or have died off, which is why neurologists tell their patients that day 1 of the onset of this disease likely occurred several years prior to their diagnosis. Typically, people over the age of 60 succumb to this disease, although 5 to 10% of those under the age of 50 can manifest symptoms of what are known as young onset Parkinson's. This disease is only second to Alzheimer's disease as the most common neurodegenerative disease in North America. In Canada, there are over 100,000 reported cases. 40,000 in Ontario. And 10,000 people right here in southwestern Ontario live daily with this disease and the symptoms on a daily basis. And unfortunately, those stats are on the rise. It is determined that by the year 2031, which isn't that far away, the case number will double, as will the costs associated with treating this disease. People with Parkinson's disease rely on their initial diagnosis and their subsequent treatment by a neurologist or a movement disorder specialist. However, sometimes to get an appointment, it takes up to 24 months. And that's if you can find a specialist that actually is taking more patients in their practice. During COVID, many in-person appointments have been non-existent. I heard of one that was done over the telephone, which I find amazing. However, this is very discomforting knowing that this disease is accompanied by high anxiety and depression. So this doesn't give a good scenario. And additional support services are usually required as the disease progresses. The expertise of people such as a nutritionist, massage therapist, occupational therapist, physiotherapist, speech language pathologist, and even the social worker or a counselor of sorts. And the services of this team of professionals can be very expensive over time, both personally and to the healthcare system, as well as being difficult to access. But fortunately, we have a really wonderful supportive agency in London, the Parkinsons Society, Southwestern Ontario. They take and provide newly diagnosed clients with resources and referrals so that they can better navigate the healthcare system. As we all know, COVID-19 has altered how every organization functions. Gratefully, technology has allowed staff and volunteers to connect with members to allow opportunities so that they can engage in physical, social, and mental activities, webinars, exercise programs, conferences, and even weekly newsletters are meeting the specific needs of this Parkinson community. Even the mental health wellness is being addressed by the society as they provide counseling for anyone that is really feeling the negative impacts of this pandemic. Pre-COVID-19, we offered 3 distinct programs in person for the residents of Sarnia-Lambton: a monthly support group meeting, a monthly care partner support group meeting, and weekly exercise programs. The former have continued virtually during the pandemic, but for safety reasons, the in-person contact has been discouraged. So many are relying on Zoom and YouTube for virtual exercise instruction. Because we also continue to support the Rock Steady Boxing Initiative, something that was launched again by the Parkinson Society, some of our members have returned to the gym within the health protocols. An important benefit of group exercise is that sense of community. And that is the main reason so many returned when they had an occasion to do so. Research has shown excuse me, that exercise can help to slow down the progression of the disease for many, as well as helping to manage the symptoms of the disease. So for that reason, exercise is considered to be a good secondary treatment option. The type of exercise you choose doesn't matter. What's really important is the commitment to choose something and then do it consistently so that you're building all of your strength. Tai Chi and yoga, for instance, is good for memory and stretching and balance. Dance is good for amplification of movement, as well as patterning, and rhythm, which is good for cueing. And of course, the Rock Steady boxing program is done in a circuit style with a no contact boxing component. And it's designed specifically for Parkinsonians to meet their needs of balance, memory, coordination, agility, cardio, and of course, socialization. Parkinson's comes with a lot of symptoms, as well as some of the side effects that are manifested through the medication. Common problems are insomnia, hallucinations, REM sleep disorder, difficulties choking and swallowing, loss of taste and smell, bladder and bowel issues, cognitive impairment, balance issues, and a myriad of more. Although this isn't an exhaustive list, I just mention them because many of those symptoms are not visible, yet they very much exist and they impact very profoundly the life of someone with Parkinson's. One other thing I noticed when I first was given the diagnosis and started doing some research is that Parkinson's has a very unique vocabulary. Words like akinesia, bradykinesia, dyskinesia, dystonia, dysphasia, festination, freezing of gait. And I'm just going to comment on a couple of those that tend to be the most common for many of us. Starting with bradykinesia. That refers to slow and small movement. You've probably seen shuffling steps, people trying to get out of a chair, trying to eat, cutting their food. Thought processes slow down, digestive system slows down. We even have other terms under that umbrella that refer to small or slow movement. One is micrographia. That's handwriting that tends to get smaller and smaller and more cramped, and especially as it gets near the end of a sentence. Hypophonia. This has to do with the strength and volume of the voice and speech issues. The speaker usually thinks they're speaking in a normal volume level, but in actuality, the listener's hearing a whisper. So there has to be a great amount of amplification, and that's where your speech pathologist comes in play. And then there's hypomania, or facial masking. This is where the face becomes less expressive, and it's very difficult to determine what people are seeing. What is the expression conveying? Is it anger? Is it disgust? Is it depression? Is it sadness? Chances are they're quite content, but their face just isn't going to portray that for them. Freezing of gait, which is often called fog. It refers to episodes where one feels like they're being stuck or glued to the floor as they're trying to take a step. It often happens when you're rushed or hurried, or if you're stressed. It might happen as you're changing, transitioning from one floor surface to another, such as a carpet to a tile floor, or you're going from an open space to a narrow space like a doorway or a hall. It may even be trying to maneuver around furniture or make a simple turn. It's embarrassing, and you need some kind of cueing to get yourself released. And the cueing will vary with each individual, as everything in Parkinson's does. So people use laser, they use distraction, they use rhythm, they use music, they use task-oriented focus. So you just have to figure out what will work for you. And the last one I'm going to mention is festination. This is where you take very small steps, very hurried small steps, and body's in a forward tilt. It looks as if the feet are trying to catch up to the body, which of course they won't. And what happens is the momentum just gets stronger and stronger and faster. And you can pretty well imagine, how is this going to end? You have to hit something or you have to fall. And anytime you fall, there's the chance of injury, which is a big problem for Parkinson's. The unpredictability of Parkinson's can be both frustrating and worrisome. We don't have a crystal ball, and maybe that's a really good thing. But because this disease is progressive in nature, symptoms change at a different rate and manifest themselves different for every individual. At the beginning of my journey, I only sensed a tremor. It didn't seem to be impacting my daily life, so I didn't think it was necessary to do any medication at that time. So for 3 years, I went along my merry way. It wasn't until after I went on medication that I noticed a pronounced difference in my energy, my cognitive abilities, and even my communication skills. Now, about 6 years later, I'm noticing considerable progression in the disease in the areas of walking and talking. Talking because my voice is becoming more unreliable and it's weaker for sure. And walking, because of some balance issues, I'm noticing that my gait is a little wonkier than I'd like it to be. Does it get me down? Usually not. However, I did have one self-pity moment last summer when diagnosed with macular degeneration. I had managed to survive 2 cancers and was settling into this diagnosis of Parkinson's when this seemingly common eye disease brought me to my knees. I believe I reacted so strongly because I had only known 2 other people who had ever had macular degeneration before, my grandmother and a former pastor. And they were both left legally blind. And that's what concerned me. How would I ever face the challenges of Parkinson's disease with limited vision? But armed with some knowledge and with some measures to deal with it, that anxiety passed and I decided to just move on and do what I could do for the day. You know, even Michael J. Fox had a moment, if you would, when he questioned his optimism and his ability to help people after he shattered his arm badly from a fall. This man had lived well with his Parkinson's for 30 years. He just had a very significant and difficult spine surgery and 4 grueling months of rehab. And yet it was a fall that broke his arm that brought him figuratively and literally to his knees. I'm sure we all have some moments like this when our vulnerability and our frailty push through and magnify our powerlessness and our humility. During these times, I turn to prayer and scripture to give me some strength and give me hope. These 2 verses are particularly comforting for me and have been in the past. One is from Romans 12:12. Be joyful in hope, patient in affliction, and faithful in prayer. And Joshua 1:9. Have I not commanded you? Be strong and courageous. Do not be afraid. Do not be discouraged. For I, the Lord your God, will be with you wherever you go. You know, faith can change one's attitude and help you have the power to face your tomorrows. God never promised to remove such obstacles in my life, but I do believe he will help me and my family go forward on this journey, armed with support systems, determination, and acceptance. This disease does not play favorites. It touches the lives of celebrities, religious leaders, politicians, and people you and I hold near and dear. But irrespective of one's belief system, race, gender, or financial status, we all have one thing in common, and that's hope. This is what drives us to get out of bed every morning and move through the day armed with a smile and maybe even some laughter in our heart. We will all take many journeys in a lifetime. Some will be difficult, some will be very pleasurable, but they all will be memorable. And despite the challenges we might experience, and we all experience some kind of struggle, I believe we have much for which to be grateful. However, it is up to each individual to either accept the challenges with a positive attitude or give up as a victim of their circumstances. As for me, I choose to enjoy life as much as in my control and to take the steps of the journey with confidence and hope, placing one shaky foot in front of the other. Thank you.
Well,